Good morning. I want to do a quick surgical Q&A about the term fat repositioning and what this means when it comes to blepharoplasty surgery. My preferred technique when rejuvenating the lower eyelids is to do fat repositioning. What is that exactly? It is kind of as it sounds. We're taking the fat that naturally occurs in the lower eyelid compartment. These are fat pads. And rather than removing them and then causing some sort of flattening or further hollowing to occur, I prefer to keep the fat and just basically recycle it or reposition it downward into a pocket that is created below this tear trough shadow. Most people who appreciate a shadow here or a line, we call it a tear trough. There are other anatomical terms for it. It can be due to various reasons. Number one, aging. Number two, it could be congenital and run in the family. By lowering the fat down beneath that tear trough, we can create a smooth contour. So can you perform fat repositioning on the upper eyelid? And the answer is yes. This is a preference among surgeons, and most often when somebody has this kind of almond-shaped herniation of fat or a little bubble here, a lot of times we have to make a decision about, do we remove it and kind of tone it down a little bit? But then you have to kind of look at what's happening adjacent to that out-pocketing of fat, and if there's some hollowing or if there's some crease irregularity, sometimes I like to actually take that fat and drape it across the upper eyelid crease to create a very smooth, sort of semicircular contour there, which is youthful. We look at upper eyelids and everybody has very genetic tendencies on the upper eyelid crease. Some people are naturally full, some people are very hollow and deep, and we try to respect the natural anatomy as much as possible. But the long and short of it is, yes, we can do fat repositioning of the upper eyelid to create a smooth, youthful contour. And finally, the question I get is fat repositioning all you need to do to rejuvenate the eyelids? And that's probably a no. Most patients have eyelid aging across several layers. The first layer is the skin. So a lot of people come in, obviously they have excess skin at some point and it's hooding or it's kind of crepey or bunching. That needs to be addressed and skin will be removed, both on the top and on the bottom as required. The second layer is the fat or the puffiness or the bags that occur. So we already addressed that with the repositioning. And finally, it's going to be just the sagging and the looseness of these structures. So these are layers of the eyelid. The tightness of the apparatus really corresponds to muscle and the ligament that holds the corner up. And many times, especially in advanced age, 50 years and up, I like to tighten the skin, tighten the muscle, tighten the ligament to create the most youthful contour that you can get during surgery.